Stroke is the leading cause of serious long-term disability and the fifth leading cause of death in the United States, affecting nearly 800,000 each year. In New York City alone, EMS treats approximately 50 strokes per day, totaling over 18,000 per year. Large vessel occlusions, or LVOs, are among the most devastating types of stroke. While LVO strokes account for approximately 20 to 30% of all ischemic strokes, they account for 2/3 of the severe disability and 3/4 of the mortality. Most LVOs are caused by a clot that has become lodged in one of the primary arteries of the brain. Alteplase, the medication used to dissolve clots in ischemic stroke, is less effective at treating LVOs. A recent study indicated that the success rate of LVO reperfusion with Alteplase only was 10%. In 2015, new evidence showed that mechanical thrombectomy, or endovascular removal of a clot, improved outcomes for patients with LVO strokes. This procedure became the standard of care for eligible patients, dramatically changing the landscape for stroke treatment. Over the past 2 decades, New York State has designated primary stroke centers, hospitals that can effectively care for acute stroke patients, including the rapid administration of Alteplase. In light of the new evidence, there are new designations for hospitals that can perform mechanical thrombectomy. For EMS transportation decisions, these hospitals are referred to as thrombectomy stroke centers. Similar to treatment for all strokes, early intervention with mechanical thrombectomy for LVO strokes is essential, so an emphasis is being placed on improving early identification of potential LVO in the field so that patients can be triaged efficiently to the most appropriate stroke center. Leading experts believe that patients with LVO stroke will receive significant benefit from direct transport to a hospital that can perform mechanical thrombectomy in a timely way. The New York City Regional Emergency Medical Advisory Committee and the Fire Department of the City of New York have adopted the New York City Speech plus LAM scale, an integrated stroke screening and severity scale that assigns a numeric value to the following categories: speech, facial droop, arm drift, and hand grip strength, in order to identify potential LVO patients. Patients with an NYC SLAM score of 4 or greater are more likely to have an LVO. Exclusion criteria are then assessed to ensure patients are right for the LVO transport protocol. If the patient has symptoms of a stroke, but an NYC SLAM score of 3 or less, or meets any exclusion criteria, EMS will take the patient to a primary stroke center after making the appropriate pre-hospital notification. If a patient has an NYC SLAM score of 4 or greater in the field and has no exclusion criteria, EMS will trigger a discussion with an EMS telemetry doctor to determine whether a patient should be directly transported to a thrombectomy stroke center. Let's take the case of Ms. Jones. She's at dinner when she suddenly develops difficulty speaking and cannot move the right side of her body. Her family quickly recognizes her symptoms and calls 911. The operator understands that this might be a stroke and dispatches an ambulance. On arrival, the EMTs quickly assess Ms. Jones for acute stroke. They find her fingerstick glucose, determine last known well, and perform the New York City SLAM score. Their assessment reveals a New York City SLAM score of 5, suggesting a severe stroke and potentially a large vessel occlusion. The EMTs call the telemetry doctor to request transport to a thrombectomy stroke center. Given the NYC SLAM score and no exclusions, the telemetry doctor approves the transport. As the ambulance travels to the thrombectomy stroke center, telemetry will call the ED notification line to alert the hospital that Ms. Jones is en route with LVO symptoms. This notification is key to priming the emergency departments and the hospital stroke team's response. Doctors, nurses, and other team members prepare for Ms. Jones' rapid evaluation. The radiology team prepares the CT scan, and the stroke and interventional neurologists are notified to be ready. Treating stroke patients requires the ultimate of teamwork. REMAC, FDNY, and our partners thank you for your support and look forward to ongoing quality improvement for the patients that we serve every day.